Hi, and welcome to Chronically, formerly known as Concussion Talk Podcast. My name is Lauren Zayaks,
I'm Nick Mercer.
and we're teaming up to talk about all things chronic illness. We'll still be talking about chronic concussion, but we're going to follow a lot of other journeys along the way. So make sure to subscribe and check back in. Thank you so much for spending your time with us.
So those sorts of things, yeah.
The difference in infrastructure, right? Even just
Right.
an intramural athlete versus a contact athlete versus an athlete who slips in or a student who slips and falls on the ice. That total different anticipatory feedback network, especially what we're learning about with FND's component in long-term symptoms. And there was an interesting paper. We just had our annual meeting, CSM for PT, and the great Adrian Lowe and crew were speaking about pain, and they were talking about a study where they looked at derby drivers versus slip and falls, and the interesting change in just pain mechanisms, even though the derby drivers have more impacts, more whiplash, greater velocity, and just how your brain anticipating playing football and the environment that you're in versus if I get hit rear-ended at 25 miles per hour in the motor vehicle accident world, that's like the worst patient to get with the longest chronicity is that low speed rear-ending patient.
Yeah. And I've never been able to prove this, but I sort of have like a personal theory of the person, the football player that is at high risk for concussion, prolonged recoveries, like bad outcomes, they don't make it out of high school, right? They're not going to make it to the next level. So there is this sort of like selection bias. This is my personal theory. I have no data on this, but I don't think that person makes it to the next level, right? So there's sort of like a concussion resilience that sort of naturally occurs as you kind of move up through the ranks,
Yeah.
particularly in a sport like football.
Do you include, let's say you have a lacrosse player who has a slip and fall while they're out enjoying themselves on a Friday evening. Do you include those mechanisms of injury and parse them out to have some of that data?
Oh yeah. So we have like 5,500 concussions, and I think somewhere between a third and a half are outside of sport, something like that. And so, I mean, and it's everything you think a college student would do, right? So it's like fell down the stairs at 1 o'clock in the morning. I'll leave you to like figure out why that happened. We have the classic like woke up from the top bunk of the bed in the dorm room and hit my head on the ceiling. We have a student that sneezed, hit their head on the desk. Slips on the ice, crashes on the bike, car crashes, fights. Like we have all of that is in there, and I don't remember the recovery between the two, like the different, if there's a difference in the recovery between the two, but those data are in there. Yeah.
The best I remember was I don't remember all of the details of this individual, but they were an athlete in some sort of contact sport, and maybe it was soccer or something. And she was trying to unclip from her stationary bike and fell off and hit the wall. And the big thing was, how is this injury taking me so long when I got elbowed in the head 400 times while I was playing, right? And you don't have a great answer to something like that, but you definitely see it out there in the real world.
Yeah. So, I mean, and we hear more in the civilian space, but people are like unloading laundry and they hit their head, they come up and they hit their head on a cabinet or a door or something. And yeah, so that's part of the what makes it interesting, right? Is like there's just we still can't predict it, as much time and effort as we put into it.
You're saying that it maybe, I don't know, psychological is, I want to say, you said don't want to say a cognitive, but let's say depression or even say, are there any other mental illnesses like seem to have a larger effect on or a little larger importance for long-term concussion symptoms than say physical or more obvious like headaches or whatever, like eye strain, that type of thing? But you think that the mental issues are more prevalent or more pronounced?
Yeah, I think what we see largely is if the person is coming into the injury with a pre-existing condition, it tends to get magnified afterwards.
Okay, yeah.
And the other thing we see are the people that are high somaticizers. So the people that like really are focused internally and why does this feel that way? And I'm going to ruminate on this headache or this neck pain or this fatigue or whatever the case may be. Those people tend to have longer recoveries as well, right? So this is where the there's the sort of like biology of the injury, which we understand is like stretching of the neuron and the shifting ions. But there's also like the psychology of it, right? So this is the somatization and maybe some pre-existing conditions. And then there's the sociology, right? That sits around it, right? So you have, we mentioned like this car crash, like it's pretty clear that people that have litigation around their injury have longer recoveries, right? So there's a social function around it. And we've probably all been in environments where there's sort of this just like suck it up, minimize it, move on, or the sort of like, I don't know, you're encouraged to talk about everything, right? And I don't have data on this, but I am kind of looking forward in the next 10 years, particularly at the college level, where we have like NIL now in the United States, and then student athletes are also having like, there's financial, right? Like them not being on the field has financial implications. So that can play into kind of how these things are going to play out.
So are you going to do Enneagram and Myers-Briggs testing on everybody moving forward?
We don't have any plans for that, but it's an interesting idea. So we do a pretty, I had mentioned the baseline test. We do a pretty robust, like personal and family medical history intake. So we have a lot of the pre-existing conditions and trying to understand, use those things to sort of understand why recovery may take longer or shorter or whatever the case may be.
As you've been talking about this 1 year versus 5 year cohort, I have just an aside question you may not have an answer to, but when I was with the ski team, we talked a lot about like that change in sense of self after they retire, especially because they start in their sport so young, right? I mean, they're traveling at a very young age compared to college athletics. And do you see any sort of strange correlations in that 1 year versus 5 year in that mental health piece? Just incidentally, do you feel like there's any of that like transition period almost that they go through?
Yeah, so we had the same question when we were building it out. So we administered, it's called the Athlete Identity Measurement Scale, the AIMS, and which is how strongly you do identify as being an athlete. And that we used it as a covariate, and my recollection is it didn't affect the models at all. I was a little surprised at that, but that's why we put it in there. We asked the question, and it turns out that at least in our data, it didn't work out. So
that's really interesting.
And I think that's good. I actually think that's a good finding, right? Like, I think there's more that can be done to help students through the transition period, but at least it's not affecting kind of how they're perceiving their mental health kind of when they're on the other side.
I mean, we need that kind of statistic, right? Because we want to be aware of it, we want to talk about it, but then maybe we don't have to give it a ton of airspace either, and almost create an environment where they become concerned about this transition of sense of self. Yeah. Well, this has been just fascinating. Oh, I do have one more question because so we in the concussion space, again, I kind of work more so on the downstream end of things, but we all are supposed to be aware of the risk factors and that sort of stuff. So we've been sort of trained. The latest research was if they have ADHD, if they have migraines, if they have anxiety, they're the people that we want to really flag. And some of these newer studies are saying like ADHD people, maybe we can stay on our medications where it used to be take them off of don't give them any stimulants, right? Yeah. And so are there any big changes that you would love for people to be aware of today when they're counseling athletes in those first few hours, or what kind of screening questions we should be really spending time on?
Yeah, I think so. I'll answer specifically to the ADHD question. We did have a paper a few years ago where we looked at sort of the natural history of the injury over time. And we actually found those with ADHD recovered faster. And we speculated because they were on their medication still. I don't have a good answer as to why. It still doesn't quite make sense to me. But that's what the data show. And I think that was replicated in a different study last year, but don't quote me on that. So I think that's sort of one thing that we're seeing. There was sort of this common language around previously, but the data just don't support it, which is, why we do science, of course, right? I think my general sense, work very closely with your physician on kind of what medications they should stay on versus they need to come off. But in large part, what I'm seeing is they're staying on, like any medication they were on for a condition prior to the injury, they're staying on like during the recovery process. But it's really a case by case process, and you need to work with the physician because they'll have a better understanding of kind of, the drawbacks or potential drawbacks of anything that they're on.
Yeah, that's good to know. You'll have patients come in, they haven't seen a provider in 4 weeks, and then their friend told them to come in. And now I'm like, okay, this is going to be fun. And then I stopped all my medications because I read online that I shouldn't take my stimulants. And let's go over to the sports medicine doctors and
Yes.
get you in right away.
Yeah. Despite popular opinion, Dr. Google can be wrong on occasion. So.
Especially with emerging science.
Yeah.
I have a question for both of you, because you're both athletic trainers. I know the last time either of you practiced athletic training, but you guys both saw both the athletes were suspected concussions or had concussions like immediately after. And how your and now you study long-term effects of concussion, so you're at both ends of the concussion spectrum. So how does your say long-term what you know about long-term effects, how does that affect how you would think you would have probably hadn't treated athletic training in a long time, but how would that impacted your athletic training career, or I don't know if that makes sense, but vice versa.
Yeah. Lauren, you want to go first?
Well, I mean, I just live in imposter syndrome because I don't get to practice as an athletic trainer anymore, but I'm a sports medicine person who became a neurotherapist and complex neuro. So I just kind of live like half in each world. But I haven't worked on the sidelines since 2014. And so I would do everything different, right? And I mean, and I work, my years in football were 2010 through 2013. I had a football experience, and you wouldn't do pretty much anything today the same as you would then. So all I can do is feel bad, but then remember that that's why people like Steve do science to help us grow and do better. So I don't have a good answer for that question.
Yeah, I very similar. I would give a very similar response, Lauren. I think, when I was practicing, we were doing what was the best medical care at the time that we knew. And, we have learned over time. I mean, I started my athletic training career and certified in 2000, and we were putting people back into play same day. Same day loss of consciousness, you put somebody back in, right? Because if they said 20 minutes later they didn't have any symptoms, you'd be like, okay, go. Yeah. Like that's unimaginable today, right? Like that. So, but this is like the evolution of science and medicine as we sort of learn better practices as we go. So I do think this sort of like long-term question has driven a lot of medical change for the better. And, probably 20 years from now, 25 years from now, we'll be looking back and like, what were we thinking in 2026? Like, that's insane.
I think we're doing pretty good now.
I think we're doing a lot better than we were, but also like it's going to evolve.
20 years, who knows?
Yeah.
One of my football rotations, we had the concussion room where the athletes had to check in. They had to be present for treatment time. They had to go sit in the dark room until treatment time was over, and then they had to go back to their dorm room. I mean, like we were doing way better than that, and that was state of the art. That was the best thing to do.
Right. So, I feel sad for those athletes that sort of went through the things that we had them do, but like we were just practicing the best medicine that we knew at the time. So,
yeah. Well, I know we've taken up a lot of your time. The last question I had written down was grading of concussion. I get this question all of the time. We know loss of consciousness has no predictive value. We know it actually doesn't happen that often. And so patients are always asking, well, how do I grade my concussion? There's talk about we grade them after the fact when we see how long they take to get better. Where do you think we're going to go? Or are we basically going to have to wait for biomarkers or some other objective way to measure the severity?
Yeah, I got asked this question. This person I'm dealing with, they were like, it's just a mild concussion. I didn't really react to them because I'm like, I don't need to get into that. But I'm like, it's yes, no. You either had it or you didn't. And we can talk about how long the recovery is, and if you want to say a 21-day recovery is more severe than a 7-day recovery, then like, okay, I can live with that. But just from like a concussion, yes, no, is sort of the way I think about it. I do think, we spent a fair amount of time, as we were looking at sort of what normal recovery looks like in our cohort. And it's really anything up to like 28 days, right? So we commonly hear that 14 days is average, which is true. Our data show the same number, but average is 50%. right? So there's another 50% that still have to go. So we spend a lot of time trying to push this idea that normal, anything up to 28 days is normal. And that encompasses about 85-90% of at least college athletes. And I think that as a clinician, Lauren, I hope you can appreciate this. You get somebody and they're coming in and it's day 15, 16, 17, and they're thinking, well, like averages, like what's wrong with me? Why is it so bad? Why is it so horrible? I'm like, it's all good. Like you're on a good path. You need a couple more days. It's no big deal. It also really helps us when we're working with our administrators, our coaches and other administrators, because it's like, it could take up to a month, right? And so there's less of this, like, are they back today? Are they back today? Are they back today? And it gives you a little bit of a buffer from a clinical standpoint to manage that athlete a little bit better.
So the big things as we kind of wrap up here that I'm going to take away from today is making sure that we work with our physicians and we update them on the medication changes and making sure that we're not just carte blanche changing people's meds just because they have a concussion. Early access to care is so important.
Yeah.
If we take anything away from the DoD, the Care Consortium study, is that these athletes have this incredible infrastructure. And so waiting 2 or 3 weeks to finally go to the doctor because you still have a headache actually puts you maybe at a little bit of a disadvantage in the long-term recovery process. We want to be mindful of mental health changes, especially as our number of concussions stack up over time, but we don't know exactly yet what's going on there with cognitive changes. And then stay tuned for the next 20 to 30 years so we can know what these people will look like once they get to their 40s and 50s. And we can start to infer that maybe a little bit into the general population, knowing that we had to have really high selection bias in order to get really good outcomes, because that's just how research works. Is that a fair?
I think that's a great summary. So thank you for helping me out there.
Just in case you needed to get your life in order.
Yeah.
Well, Nick, any final questions from you before we let this busy man go?
Yeah, this is just pretty administrative stuff, but your podcast or your podcast, the University of Michigan Concussion Center, where's the best place to reach out for information on, say, on studies, research, or your podcast? Where can they find that?
Yeah, so the best is to go to our website, concussion.umich.edu, or if people want to track me down individually, I'm the only Broglio at Michigan, so I'm pretty easy to find. And I'm happy I do my best to answer all my emails. I'm a zero.
Broglio is Broglio.
Yep, you got it. And unfortunately, we haven't done the podcast for, I think, a year or so now. It's sort of things got in the way of getting it done, and then it sort of never got revived. So, but it was fun, and I enjoyed talking to a lot of the great researchers and clinicians and advocates. But I don't know, maybe this will inspire me to restart it.
Yeah, go for it.
If you want to find his research, he has an entire academic page as well, where you can just scroll and scroll and scroll through the names of studies.
But done that.
Yeah, thank you everyone for taking the time to listen. I know you have a lot of other things you could be doing, but I hope you were as impressed as we were today, and you learned a few things along the way as well. Make sure you keep tuning in for more of Chronically. You can find us at Concussion Talk and at LZIAX on Instagram, and don't forget to check out the University of Michigan's Concussion website page as well. And thank you so much for your time.
You bet. Thank you for having me on. This was great. Enjoy the conversation.
Thanks.